Hi, I'm Dr. Schaefer at Schaefer Plastic Surgery in New York City, and today we're going to do a live injection of Kybella. And we have a nice model patient here. We're going to talk a little bit about the product first, and then we will proceed with the injections. So first of all, why don't you tell us what's bothering you?
I had this double chin and excess fat, so I have decided to have a conservative, treatment.
Yeah.
And so I came to Dr. Schaefer,
Excellent.
who I believe that can do best for me.
Excellent.
Okay.
So while you're looking in the mirror, let me just show you a few things. So naturally we all have a little bit of fat under our chin here. And there's a couple treatments that we can do for it. The least invasive is the Kybella, which we're going to do today. And what that will be is some injections all along this fat area, and that's going to help melt that fat, and your body absorbs it, and then the area will shrink. The benefit of it is you don't have to have surgery. It's a minimal recovery. One thing you have to know, though, is you're going to have to do multiple treatments. So in the FDA studies, there's anywhere between 2 to 6 treatments required. Now, you don't have a huge neck, so you may need 2 or 3, possibly 4 treatments. But there's no right answer, and what we do is do the injection. We see you in a month, and then evaluate you and see if you need another treatment. But 1 treatment is never enough, but sometimes 2 will actually do it. And we'll see how that works. Other options for people, if you don't want to go monthly for the treatments, would be to do liposuction. And that we would do in the operating room, and there's a small incision under the chin and one behind each ear, and then we go in there and we suck the fat out. So the advantage of that would be that it's a one-time treatment. The disadvantage is you have to go to the operating room, and there could be more swelling and possible bruising from that. Now, some patients come in and they have a lot of loose skin here, which you don't have. Or they'll say that my jowls are bothering me here. And then I'll say, what bothers you? And they take their fingers and they push up on their face here and they say, this is what I want. And if you have to take your fingers and really push to kind of get the result that you want, a lot of times it's a surgical thing, and that would be what we call a lower face lift. But right now, I think the perfect thing for you would be the Kybella, because like you were saying, you want a minimal treatment and quick recovery, so I think it'll be really nice for you. The FDA indication is to melt the fat. Sometimes, even with a little bit of loose skin, you'll see some skin tightening. But if you came in here and you had a lot of loose skin, you definitely would not be a good candidate for Kybella, but more of a candidate for a lower face lift. But you look perfect for it. All right? There's a couple risks. So you can get a small chance of bruising, and you'll definitely get some swelling, okay? Some people, the swelling will just be a day or 2, but some people it can last even up to a week. So you have to be prepared for that. A lot of times it's swelling that maybe I would notice or you would notice and nobody else would notice, and sometimes you can get a little more than that. But when you do get the swelling, that's actually showing that the product's working, because it's in there causing a reaction with your fat cells, and then your body absorbs.
Interesting.
Do you have any questions?
I can't wait to have it done.
Excellent. Good. Well, what I want to show you too is we did some computer imaging, and this we do with our patients for any face procedure or for any face procedure or body procedure. So for here, we took a 3D picture of your face, and you can see that on the left, and when we rotate it, you can see the computer simulation of a result that we would like to get after the treatment. So, but like I already mentioned once, 1 treatment isn't going to take you from A to B right here, okay? But as we do treatments, it's going to sequentially shrink down and tighten up and give you more definition. Of the jawline and underneath of the chin. So, but this is a realistic expectation for somebody. And it's good when patients come in to talk about and do the imaging and make sure everybody's on the same page about what to expect from the procedure. Again, if you were coming in saying, I want my lines here fixed, that's not what Kybella would be, that would be Juvederm. If you wanted your cheeks lifted, we could put Voluma. If you wanted the wrinkles around your eyes or your forehead, We could do Botox. So there's lots of non-invasive things we can do for the face. And actually a new injection called Kybella, which is really nice to put around the lips, just to give you some definition. So it's nice to kind of look at a picture and look at it objectively and see what kind of things you want to do. But what I always tell people is there may be a long list of things you want to do, but set your priorities. And so today it'll be for under the chin, and then people want to set their budget and then their amount of time that they have for recovery and downtime. And again, the great thing with the Kybella is it's going to be minimal downtime and minimal discomfort when you're having the procedure. And we'll go ahead and do it, okay?
All right, so when would be the next or the second treatment?
So
how long?
You want to wait at least a month between treatments. You can definitely wait longer, okay? So let's say you came every 6 weeks, that would be okay too. You could come back every 2 months, but you don't want to come shorter than a month because the product is still working, okay? So we don't want the product to still be working and do a second treatment on top of that one, right? And we don't want to do unnecessary treatments either. So if you waited a month and it looked good, then you may not need the fourth treatment or fifth treatment that way. So
Interesting.
So what I'm going to do is lower your chair back a little bit, and I'm just going to have you tilt your chin up. And what we did already before we started filming today was to apply this a temporary tattoo. And what that does is it helps doctors see where to put the injections. And then you can customize which dots you're going to use for the injections depending on where your fat distribution is. And so just like how we're looking in the picture, we're going to treat this whole area, okay? And it's a tiny injection. Have you had Botox before?
Like maybe 12 years ago.
Oh, okay. Well, we got to get you back on that. But it's a tiny needle, so it's a tiny Botox needle. So they really don't make a smaller needle. So you don't need to worry about that. And I'll do a few injections, see how you're doing. If you want to take a rest for a minute, then we can. And then when we're done, we just put a little ice on there to help with comfort.
Okay.
All right.
I'm all set.
Great. I'm gonna get some gloves and then we'll do it.
All right.
So as you can see here in the Kybella box, the Kybella comes in different vials. Most people, we use 2 vials per treatment, but it depends. If somebody had a larger neck, we may use 4 vials or 3 vials. It all really depends how much the patient needs. So what I want you to do is just put your chin up in the air, good, and then you're just gonna inject, good, inject. How are you doing? Good, inject. Okay, I'll give you a break for a minute. How is that? Not bad. Good. One thing we did ahead of time before the filming was put some numbing cream on. And so most patients, when they come in, will put the numbing cream on at the beginning of their appointment, and then by the time we get around to the injecting, the skin is nice and numb. There will be some discomfort after, because you're having the shot, but the discomfort isn't from the shot. There's a chemical reaction going on under the skin. And what that is doing is interacting with the fat cells, and then your body will absorb the fat cells and make them go away. So people ask, is this a permanent treatment? And it is a permanent treatment because you're destroying those fat cells. So you'll have less fat cells. Just like if you're going to do liposuction, there'll be less fat cells in those areas. How you feeling? Good. And as people can see, it's a tiny needle, so it is a few injections, but it's really the tiniest needle that they make. Like I talked about, you know, small chance of bruising, usually in about 10% of people, maybe a little bruise. And then the swelling like we talked about. If you do get a bruise, we have a laser here. It's called the V-beam Perfecta laser. And we treat it with the laser, and what it does is it can turn a purple bruise or a darker bruise into a light pink one. So that way, at least you either blends into your skin or much easily covered with makeup. We're almost done here. We're on our last row. And you're doing fantastic. And you will get the swelling, and then we're also putting volume under the skin because of the volume of the actual product. So that adds to a little fullness, but that absorbs over an hour or so. So most patients, what I tell them to do is come at the end of the day. So that way we can do the treatment, and then any of the major swelling is gone by the next morning, so they can go back to work. So you really don't have to miss work when you're having this treatment. So we did 2 vials of Kybella, and I'm going to just give you some ice to put on there for a few minutes.
Oh, we're done?
That's it.
Wow.
Yeah, it's not bad at all.
Wow, not bad.
So a typical appointment would be about 15 minutes by the time we put the numbing, and then so just hold that ice on there. By the time we put the numbing, and then place that temporary tattoo, and then did the injections. And that temporary tattoo will wash off before you go home, so you don't have to go home like that. So how did it feel?
That was easy.
Yeah, not bad, right?
Yeah.
Good. What other questions do you have?
Let's see. It's just
It's pretty basic, you know. Tonight, if you want to put some ice on there, if you get some swelling, it'll be okay. And then we'll see you in 1 month and decide if we're going to do another injection. Like I said, you need to do more than 1 injection. So, you know, this will be the first one. We'll definitely do a second one. And then the next appointment after that, then we'll decide if we need to continue and do a 3rd one after that. All right. So we're going to let you rest for a few minutes with the ice, and then check on you. Have a good day.
Okay.
It's a nice day here in New York, and thanks everybody for watching. And then if anybody wants to see any other procedures performed on Facebook Live, just put in the comment section, and we'll arrange to do a live procedure. Have a good afternoon.
Thank you.